content shared, lots of presentations, but there's still the practical element of everything, and this is what we decided to offer you at the end of the day with the presentations from 3 cases. We are going to start, first of all, with Barbara Faria. She's an economist and she also MBA from Universidad Católica. She's currently business development at healthcare at Multicare, famous health insurance provider here in Portugal. And she's been in the past life science and healthcare consultant, and with past experiences also in Novartis, and where she has started her career. Barbara, the floor is all yours for 15 minutes, and delight us with your case.
Sorry, do you mind if I stand? Probably better. So thank you. First of all, let me a quick intro on Multicare especially for the international panel. I believe most of the Portuguese will know what Multicare is. We are the biggest health insurance in Portugal, with more than 1,200,000 insured people. That's more than 1/3 of the market share. So right now, the health insurance market in Portugal already covers more than 3 million people. And Multicare is the biggest of all. I'm very glad we're at the end of the day, because I will be touching in a lot of, even if I didn't know, I will touch in a lot of topics that were risen through, especially also through the afternoon. So very glad to be able to share some of our examples and the practical cases of what we are doing to address some of the challenges and topics that we've seen already. So starting with longevity, what brought us here? This is no news. This was covered at the beginning of the day. So Portugal has a huge longevity challenge with being one of the, and already is, and being one of the highest elder country in the world. But what really strikes us, and what we as a health insurance and also as a Fidelidade, the group of Multicare, also with life insurance, is also very worried about, is about the healthy years, because we're expanding the lifespan, but we're not decreasing the disease years at the end of our life. It's actually slightly increasing the projections of it. So we don't want that. I mean, as a society, we don't want that. As a health insurance and life insurance, of course, we also don't want that. We want people to live more, but to live with more health for more years, and that's what we want. And that's what we want to address. Why is this important, and how are we tackling this from an insurance perspective? We know that a lot of the last years of our non-healthy lives at the end of our life will be covered with, we will have a lot of diseases, chronic diseases. I mean, the usual suspects of diabetes, cancer, cardiovascular, respiratory. It's no big news. The point is that there's a lot we can do in order to not reach that point and to delay it later in life, and also to, along the way, reduce the cost and the burden of that disease by changing our habits and by changing our behaviors. You can go up to almost 50% decrease in cost of the disease along the year if we take action and we change our habits and have healthier habits and lifestyle. And it's not only in terms of our physical health that we can do that, it also has an impact on our mental health. Physically active people will have lower chances of developing dementia and neurodegenerative diseases, and also very lower chances of getting depression. So it's time to act. We understand we have a role, and we want to promote that actively to make the most out of those years, to decrease the disease years at the end of our life, or actually not at the end of our life, to decrease the disease years along our life as a whole, and thinking about longevity not as only at our latest years, but also, as Zora was mentioning, I mean, being healthy and in a sustainable way across the full range of our lives. So we're focusing on getting longevity and a good life with health along the way, and we are promoting it actively. We know that health is no longer, and we want to change that paradigm, that being healthy, it's no longer the absence of disease. It's the state of well-being, of mental well-being, of social well-being. And we want to make part of that changing paradigm. And also, our role as insurance company is also changing, and we are changing across with it within health. We don't want to be fully financing the disease. We want to be promoting the health. It's actually funny because in the insurance company associations, which in Portugal is APS, the way that we are categorizing the different lines of business on insurance, it's like motor or auto, which is all of us has to do, like the mandatory insurance. You have the life business, and until very recently, the health business was called disease business. So it was the disease line of business. It was not health, because the insurance companies were traditionally financing the disease, and financing the providers and our clients, of course, in treating the disease. And we want to change that paradigm, and we also want to finance health because it's better for all of us, and in the end, it's cheaper also for us. So, what have you been doing about that? So we have been, this is a roadmap of what we have been doing since our early stages. So actually Multicare, it will be 25th anniversary this year, and we started this road on prevention back in 2009, where we were the first ones to promote regular checkups on our clients, fully with no co-payments nor capital consumption. So all of our insurance policies, so all of our clients would have included and have access to this annual checkups, because we believe diagnosing earlier will, of course, have a better chance of positive outcome in terms of the disease, and only a lesser cost to treat that. But then we went further in that journey, and in 2016 we launched our telemedicine platform. It was unique and first in the market, with first teleconsultations and then video consultations through app, through PC, and through phone, of course. It started only with GPs. It then expanded to 24/7 GPs. It now has more than 12 medical specialties, also including psychology, and an a large array of well-being services and programs, such as nutrition appointments, such as physical activity programs monitored by personal trainers. We're talking about already, and when we launched the last one, the mental health part, we added also in our online medicine platform programs for sleeping better, for managing stress and anxiety. So all within the remote platform and through digital channels, and promoting convenience to our clients. I'll go in a bit more detail afterwards. The pandemic didn't move us, and so in the midst of the pandemics, we launched 2 of our major breakthroughs in the innovations in the market in the last years. First in 2020 with the launch of Multicare Vitality program to all our clients, and then the mental health coverage in 2021. I'll go into further detail in the next slides. Just wanted to reinforce that the first three initiatives I'm talking here, so all of our checkups from prevention medicine, the online medicine, and the Multicare Vitality program are all included in our policies at no additional cost for the insured person, nor capital consumption. The only exception is for some companies, the Multicare Vitality program, the company will pay for some of the rewards of the program, not the employee. So it's for the insured person, which has access to and can use their health insurance. It's totally without any additional cost. I want to show some results because this is a case. So our online medicine platform has been a success case. Our partner is Teladoc, the big digital health company featured in New York stock market. We are one of their success cases outside US on the adoption. We've seen, of course, the pandemic giving a help with a sharp increase in the teleconsultations in 2020, but we were not sure, is it here to stay? And we're now sure that it's more than here to stay. Our projections are to have more than 200,000 consultations this year. We're pretty much on track by now at date, and it's really a value, one of the highest perceived values from our customers. So the satisfaction levels are to the roof. It's one of the elements of the health insurance most valued by our clients. So almost more than 90% are very much satisfied or satisfied with the services. They have no co-payments, so they can have a teleconsultation instead of going to the hospital or to a private clinic and have to pay nothing. And we know that the more than 90% of the people that use in the acute situations, the 24/7 with GPs, get the recommendation and stay at home and get their issue resolved, which is a huge resolution rate. So you can imagine the savings we're taking. So we're taking people, I mean, I said, I believe it was Anna that was mentioning, so we need to take people out of the hospital that shouldn't be there. This is the case. So this is what's happening when we take people out of the hospital. So 90% of the calls of our platform.
Barbara, 2 minutes to wrap up, please.
Okay. So I'll jump into Vitality. Just a quick overview. So Multicare Vitality is a program that rewards people and incentivizes them to change their habits. So we are giving weekly objectives for people to do physical exercise, either by steps or heart rate. So people moving, you don't need to do a huge intense exercise. And we'll give you rewards weekly based on that. This is putting money on people's pockets for changing habits. So it's not only the intrinsic motivation, it's giving them a carrot to run or to walk or to move themselves in order to do that. And it's not only, so we want to create regular habits, but we also want it to be sustained. So the program also gives you points that will transform into premium reductions of your insurance in case you follow your parameters, your basic health parameters on a sustainable way, in a healthy way. So we reward people both ways. So on a short-term perspective, the thing that will make you go out of bed to have your morning run every week because of the weekly reward. But then at the end of the year, if you keep sustaining that behavior, we also acknowledge that you are more healthy, you have less risk, and we give you back premium. So you have a discount on your premium next year. So this is really incentivizing people changing habits to build a mindset of prevention and to eat well, eat better, sleep better, doing physical exercise, and get rewarded for that, and everyone wins in the end. This is just some numbers. I can share the presentation afterwards, Noor, so on penetration that we're having so far. Just to wrap up, and that since we're on a digital health conference, just a small note on another innovation we just did when we launched our mental health coverage. So apart from all the regular treatment insurance company product build on the capital coverage for the consultations and for the inpatients and the outpatients, we just innovated by reimbursing mental health apps that promote a healthier lifestyle and promote the mental disease. Like we have the 3 here, like Calm, Headspace, and 29K. I mean, in the previous panel, someone was mentioning that, I think it was Ron, that Germany is starting to reimburse apps. This is what we're doing. Prevention apps, we believe that we want to incentivize people to use them in order to keep their mental well-being and mental fitness to prevent mental disease. And so we want to finance that and incentivize our clients to do that. It's that.
We have to conclude now, Barbara. A round of applause for this wonderful sharing case. Unfortunately, I don't see their Insight Timer, which is my favorite, but Insight Timer is an app that...
we can look into it.
You can look at that then. Also, and then I'll change to Multicare. Okay, thank you so much. We are going to have a second presentation now by someone that is well known in the field of information systems and healthcare and hospital management. I'm going to make an introduction of Victor Costa. He's an engineer, electronic engineer, but he's been a very, very active member in the community related to the IMS conference that we are a pre-event. Is the founding member of EMAIS, an association of the information systems managers, health information systems managers in Portugal since 2015, and it's an important civic society platform. And not only that, but also a member of the AL7 board as a treasury, as a matter of fact, since March 2023. So this is two fields where Victor is really an associative leader and a social innovator in that sense. His career is backed by 17 years as health information systems manager at the Hospital Center of Trás-os-Montes e Alto Douro, from where he had to travel quite a while for arriving here to be in presence, while I offered to be on remote, but Victor kindly accepted the invitation to be here in presence, and we are going to listen to his presentation. The floor is all yours, Victor.
Thank you. Thank you. Hello, everyone. I'm from hospital, the north of Portugal, in east of Portugal. Our building have 3 hospitals, and one idea is not this idea that I have in the presentation, but in the research area of the clinical academic center of the hospital. One idea is One Health. It's not the topic, but I think in the future One Health come to the front lines. But in the moment, hospital, I have 3 different hospitals in the north of Portugal, and one palliative care, and are located in Vila Real, Chaves, and Lamego. And the hospital have the region are a rural area, and with a lot of dispersion of the population, and the population is very older in some cases, and creates some difficulties and pressure to the hospital. In the last presentation, talked about don't get patient, not a good patient in the hospital. And the program that I present, is trying put these people not in hospital, but in primary care or in home. And the idea are, in the future, I think is a very important integration between different areas of the healthcare. The sustainability of the healthcare are by integrating different areas, but the focus in hospital are primary care, the integration, because 11% of the people go to the emergency room have 4 or more than 4 visits by year to urgency. And the program starts with this problem. How put these people in the primary care, not come a lot of times to the hospital. And I made a program that create a framework to support the registers and the intervention protocol. And the first are the patient select. Not for all the patient, not for all of disease. Create a journey to the patient based on the chronic disease or in the prevention area. And in a moment are using autoimmune disease, because autoimmune disease have a lot of surveys. People need to make some scores. And in the moment are integrate with the app, and the physician and nurse getting the data and can correlate of the monitorization and the register of the physician and nurse. And in development to the palliative care. And the one problem that occurs in Portugal between hospital and primary care is the professionals cannot communicate so easy. And one thing is very important in this application is allow that professionals in hospital communicate with professionals in the primary care and support primary care to treat this patient in primary care. Because in some cases, the patient go to the hospital not only to get information, and this information can be given by physician at the hospital to the primary care and stay the patient in the primary care. And the idea of the application are management all the information and monitoring the patient, but fill the gaps between the communication, primary care, and the hospital. In some cases with the patient, because you can get feedback the patient and see how stay along the time. And the idea, the individual care plan are more integration data in different teams and more teamwork, not the patient go to the hospital, go to the patient primary care and don't getting the answers. And it's possible to stay the patient in primary care and have these answers. And integrate the data and co-design the mapping and patient journey to different area. In a moment, not only to the chronic disease, the next step are apply this to the prevention, and the next project are the pediatric obesity. And this is a problem, and have a lot of professionals involved, and it's very important to connect these different professionals in center of the children. And the idea are use the digital solutions to create this ecosystem, this journey to support the children. And the idea are getting more information for the children, support, connect to the school, connect to the physiologist in the school, and get information. And the idea are putting some wearable gamification and augmented reality to support and talk with the patient, the children. And this is the next phase of this project. The project are funded by ETF4. This goal are in a moment waiting fundings, but are approval. And the idea are connect the children and the hospital in primary care and use this framework. But it's not easy make these tools because in healthcare, in situ simulation are a training for professionals, and digital area, you need training and make some simulation, because it's not the easiest part are create the digital tools, but putting field and training professional and change the culture is very, very difficult. I work in this program in last 4 years, and it's not easy to change the culture of the hospital to adopt these solutions. Thank you for your attention.
Thank you so much, Victor, for showing us how hands-on approach in northern remote part of our country and the challenges you face there and how you are tackling them so pragmatically with digital transformation. Okay, so last from our panel of presentation cases, Dr. Pedro Varandas, MD, psychiatrist, is the clinical director of Irmãs Hospitaleiras. It's a not-for-profit foundation, it's well known in Portugal with multiple establishments. And Dr. Pedro Varandas created a very innovative concept, which is the brain lab, ginásio cerebral, right? So he's going to share with us a little bit of what cutting-edge work that they are doing there. The floor is all yours.
Hello, good afternoon. It's a pleasure. I'm very pleased to be with you here in this very warm environment, very warm and very quiet environment. I may say that I'm a psychiatrist for almost 40 years. And all my life, I've been treating people with depression, with bipolar disorders, schizophrenia, eating disorders, something that has been spoken here, I think. And in the end of my career, I became to treat people, aged people with dementia. I may say that I was not the creator of these gymnasiums, mind gymnasium, brain gymnasium, what we can call it, because two colleagues that are with me here, they were the creators of that, and I'm pleased to collaborate with them in this idea of using innovative technologies to rehabilitation and to prevention in dementia. That's what I'm going to speak about. Okay, Sister Hospitaliers are a congregation, a Catholic congregation, with a mission in healthcare, above all, mental health care. It's like a multinational because we are present in 4 continents, now even in almost Australia, because we are present in Timor, that is a small part of the old Indonesia, but an old Portuguese colony. This congregation is present very strongly in Portugal and Spain. In Portugal, with about 12 centers dedicated for mental health issues. We know the numbers we have spoken about, and we now have about 200,000 people in dementia. That's what we calculate there are in Portugal. It's a huge number. And let me see. And we know that beyond the 12 modified risk factors that are identified by the studies of Livingstone, 3 of them, we are going to speak about 3 of them, risk factors that we can act and ameliorate each rehabilitation or promotion of. So, telling a story, we start in 2005 with a unit of gerontopsychiatry. Later on, 12 years later, this gerontopsychiatry unit that was started to stabilize patients with dementia, with disorders of behavior, or alleviate the informal care people, the family care people. So we start in 2017 with a residential care unit for these people with dementia, because we knew that a little proportion of the patients we were treating since 2005 need a clinical approach that is not possible to do at home or in nursing houses. From there, we evoluted to the idea of creating a senior brain gym outside our building, outside our hospital, and a day hospital for people with dementia. So it's a step-by-step evolution. For 2019, we start to do very specific neurostimulation, and then we create a neurostimulation unit that is now doing its job for hundreds of patients. From there, with the support of a lot of partners, we start with the community mental health dementia team. This is the building where we are. It's in the municipality of Sintra, and this is what I'm going to show you, what the activities we have there inside the community and surrounded by the community. So what do we do in that community brain gym? We do brain gymnastic classes, what we can call. We do cognitive screenings and health literacy sessions in the area of health in terms of dementia prevention. In this year we are going to expand our activities what we call decentralized actions all around in small parts of the municipality of Sintra. What are our activities in brain gym classes? We do, with a computerized tool, we do brain stimulation, we do virtual reality immersion, we do virtual reality in general, we do, with the help of this robot, we do some sensorial stimulation for the patients, for more severe patients. We do what I'm going to explain in more detail, exergogs, that is, oops, sorry. We do exergogs. And finally, we are going to start tech balance, which is a technology and an application, a digital application for the risk of fall. So I'm going to explain too. So immersive virtual reality, non-immersive virtual reality, with the systemic Lisbon battery that is a cognitive tool we use. With this robot that can interact with people, we stimulate, we do cognitive stimulation, and above all, sensorial stimulation, mostly for the most severe patients with dementia. Here we have the computerized cognitive training with this technology that was developed by a Portuguese neurologist called Tadine Cruz, and we are developing a lot of cognitive training. We will do this tech balance too with an application that can screening the problems that the risk of fall any person can have. And with that, we can diagnose and do an intervention based on the data that we can collect with this technology. Exergogs, that we augmented reality and gamification. What is it? It's an innovative therapeutic tool that integrates physical and cognitive exercise in dementia prevention and rehabilitation, promotes healthy aging and social connection using augmented reality and gamification. And why we use this technology? Because we know that depression, social interaction are one of the big risk for dementia. Allied, they are one of the big risk factors for dementia, allied to the absence of exercise. So integrated social interaction with exercise and cognitive stimulation, all of them at the same time, we can achieve a better result. Look what we are doing here. There is a social interaction with all the ladies in circle. This lady is doing exercise, and at the same time, this is another example, and at the same time, there is a cognitive step-by-step route to achieve the final objective in this game. So with exergogs, we can do visual and memory stimulation. We can do maze, puppets, and several activities. One of the examples of an activity is agriculture. Imagine grapes. We are going to collect grapes, put the grapes on a basket, through the basket with the grapes to a tank, and then smashing the grapes on the tank with our foot. So this is a step-by-step task that involves cognitive and exercise at the same time. And of course, if there is a competition or interaction with others that are seeing and watching what is going to happen. So this is the objective that we do with Exergogs. So it's an available solution, an integrated solution that have physical exercise tools, cognitive tools, and all them mixed with social interaction, of course. This is a case, so we are presenting the results for 200 people that have done this. We have developed a protocol of 26 sections from 45 minutes to 1 hour, facilitated, of course, by a neuropsychology or psychomotor specialist that facilitates this. Exercise can be played individual or in pairs or with the group. As you have seen, participants sit on chairs arranged in the semicircle, looking at what is going on. We have assessed many domains, and what we have as a result with these 200 patients, they have improved cognitively, affectively, social, and functionally. And of course, all these domains with significant improvement were very pleased for all the people. 200 people, they were very pleased, motivated to do it. This is a pre-experimental design. We are going to do, further up, we are going to do a design, experimental design, where, of course, compare these results with any other activity. Imagine with going to the swim or going to the movies, and then we go to compare if these results are better or significantly better than the other one. This is our team. I'm only the man who are directing. I'm not the player of this team. I may say I'm very, very proud of all these girls that are doing this job every day. The use of new technology intervention generates high levels of adherence and motivation in older people. So this is and motivation too in the professionals. So both of them are very motivated. So the alliance between clinical and academia is key to meeting the challenge of aging and dementia, both in terms of creating innovative tools and programs that truly respond to the needs of older people. I believe that we are only starting this. So the use of technologies is now in the beginning, and so if many institutions and units with creative innovation, using technologies, developing protocols, can lead in the end to a better result with very well designed programs. So this is our institution. It's nearby Lisbon, in Queluz. It's 10 kilometers from here. And this is our munitions factory. So these people is dealing with something they know. The old telephone, sensory factory. As a god.
Thank you so much, Pedro Varandas. It's a video was worth 1,000 words, right? Okay, so I just am kindly asking for our staff, technical staff, to put the slide there for our picture, as we only have 1 or 2 minutes for Q&A, and then we start the other panel. So if there's any questions for these presentations or any other proceedings. Before we're moving to the closing session, that will be in the mute. Okay, so no questions. So thank you so much. And please asking the guest speakers to be there. We're going to take a picture with you. And stand by for the next panelists to come to the... Fazer aqui uma foto. Bonnie and Anna, you could take your seats. I will introduce you in a minute. Okay, so now without you, and I think we are 5 o'clock, 1 minute to 5, starting ahead of time. If you could, thank you so much. Now we are going to go to the closing session. Wow, it's been a great day, but I'm sure Anna is going to be able to moderate this session and also introduce Bonnie Clipper, which is our chair of our executive chair of our advisory board, Digital Health Portugal. And as you can see from the slide, is a nurse futurist expert in virtual nursing and nationally recognized thought leader in as an innovative and transformation consultant. She's also a global speaker. She speaks in many different international and global events, like the case of IMS this week. So that's why we are having the chance to have Bonnie with us. But more than that, she's now a Portuguese resident. So we are so lucky, Digital Health Portugal, to count with the leadership of Bonnie Clipper here. And Anna, the floor is all yours, and you're going to close the session for us out at 5:30. Thank you so much.
Thank you. Well, thank you all for those who stay the full day with us. Thank you very much. Bonnie and I, we were talking and preparing this session, and I'll start closing telling you 2 personal stories. My personal story, the first one is when I was 40, I'm 54, when I was 40, I was diagnosed with hypothyroidism. And the doctor said, you have it. You will have it for the end of your life. And you only need to take 1 pill of hormones every day, and that's it, and you'll be fat, and there is no solution. And I said, okay. So then I start working in this area, and I realized that might be a solution. So start looking and start digging, and or by God's will or by accident, depend on what you trust. I met Zora we have a friend who was working as a tourist guide for her, and asked her what does she do, and the friend said, you need to meet Anna. So now I have someone to help me to improve my health. The other personal story I want to tell you is I practice martial arts. And once I was in a training in Barcelona with a Japanese teacher. And we were doing an exercise, and I went and asked, why did I felt what I felt? And it was like, you people, don't ask, do, practice. And I said, okay, but I need to understand why. This is your problem. You in Western society need Now I say data, you need to understand, don't just practice. Why I'm telling you these two stories is in certain way, it's the synthesis of all we were talking today. First of all, yes, you have more and more data with digital health. And with João and with Zora testimony and with Anna testimony, we can, I think it's clear that data for us in Western society will help us to engage treatment, will help us to change mentality, will help us to understand what we are doing and what are the consequences. And I'm closing this just desiring, all my work in this area is focused on business. So the reason why I'm approaching longevity is I see this a business opportunity. First of all, is a way to increase our economy, is a way to increase in developing a more sustainable society. So I'm always trying to do this and put Portugal on a map. So this is my focus, and I hope that at the end of the day, it is clear for you that longevity is a business opportunity with very good consequences. I like the panel about ethics also, because clearly is for me a hot topic. So I'm shutting my mouth and passing to Bonnie. Bonnie, it's a pleasure to be here with you. We only met once through Teams or Zoom or whatever, you know. And yes, I would like to have, well, you introduce for those who don't know you, but have your feedback about the full day we had.
Thank you so much, Anna. And it's always so great to be here. This is a wonderful group. I always feel very enriched and very grateful when I get to spend time with all of you. I learn more from you than I think I'm able to give back. So it's really wonderful to be here. For me, the way that I see aging is a little bit interesting. I love to travel. I do a lot of research. I plan where I go. I'm looking very forward to what I eat and what I do and who I'll meet and what I'll see. I don't feel that way about aging. It scares the hell out of me. I don't want to go there, and I know how it ends, but we don't have a choice. So for me, I want to be part of the solution. I want to figure out what are the things that we can do? How can we bring incremental change to make it better? Because we're all going to need it. Maybe at different points in time, but we're all going to need it. I think we learned a lot today. This was very, very fruitful conversation. We talked a whole lot. Is this word right, Anna? Aprendizado.
Yes.
Did I say it right? Okay. So there's a lot of takeaways from what we heard today. I think it was really very helpful to understand the impact that longevity has in the economy. That is not something that I ever thought about from a workplace and a workforce perspective. We often talk about the healthcare demands. We don't focus on well-being and wellness and prevention, particularly in the US. We're a sick care system, not a health care system. So you are in a different place than we are. This is a global problem. It isn't only Portugal. It's every single country has this issue. So it feels to me as though there's so much more opportunity to share what we learn, to work together, to collaborate, and to do this more globally to figure out how we can get through it together. So I'm extremely grateful. I'm going to hand this back to you one more time. But again, thank you so much for taking time out of your day, being here. It is 5:06, and everyone that is still here stuck with us. So thank you very much. Muito obrigada for that. Thank you, Anna.
Welcome. Welcome. Well, Bonnie and I, we were thinking about the next step, and we were thinking that the next step could be having us together again, but in a different format, in a format that we can be more effective in changing information. So see this as a starting point for reflection about digital health and longevity. I hope you all have enjoyed the day. I'm very happy to work with this team. It was the first time, and well, I'm very happy today. Thank you. Yes, yes.
All right. Thank you all very much.
Oh, well, thank you. The team, Pedro, Paulo, where are they? Where are they? Come here, please. Where is...
Pedro, you did all the hard work.
No, and we are missing one lady. Where is she? Inat. They were outside. Ah, she went out. Okay, thank you very much. I know if you want to say a final words just for closing.
Maybe Anna, our sponsor, can come also here.
Oh, yes.
And join us, and also Ricardo. Se quiserem vir aqui também, falar aqui um pouco. Well, of course, for us it's always a joy to make connections between people and entities. I was talking a little bit with someone and that asked me what do we do here in Digital Health Portugal, but mainly is to create momentos like this. Okay, as you know, or some of you, as you know, we don't have like bounds with whatever bounds you may think, political or whatever. So we are very independent and free to talk and to invite and to provocate whatever needs to be provocative. Of course, Paulo already has some initiatives from like Fórum Hospital do Futuro, Health Data Forum is also something to very interesting for you to go like to the websites and to the social networks, also the Digital Health Portugal social networks. And I think that, like Anna said, and Bonnie, I think this was like the starter for this kind of because longevity and all the issues around, they are very it's not easy to explain the several areas that they can touch, and sometimes it's difficult even to integrate all that information, and we need momentos like these, professional momentos, and also some guidelines from experts from the area. Of course, there are some more practical, others more theoric, but that is our life. And I'm very happy to for this 7 meetup. It's almost incredible. And also to thank you all for your time. Of course, also our sponsors, because without them, this wouldn't be possible. Also to Anna, because Anna also worked a lot building this agenda, mainly with Paulo. And of course, Bonnie, thank you for your time. I know that you love Portugal, so for you it's not a sacrifice to be here. But thank you very much.
And
okay.
Pedro, don't forget, Sandra Mateus is
and of course,
in the shadow, but
of
that's
course,
the reason why we are here. A round
of
of
course.
applause for Microsoft.
Thank
and
you,
Sandra
thank you
for this.
For Microsoft. I think that is like the.
It's good that a company like Microsoft supports this kind of conversations, and
it's the quality stamp
and
that
is
we
offering
need.
this home for us.
Yeah, it's the quality stamp that we need for this kind of momentos. Okay, thank you. I think that now probably just a few words.
Ricardo, I think his presence says everything, right? Because
now, if you want to, you can talk in Portuguese.
Ok, então quero agradecer também esta oportunidade e também a oportunidade de poder estar aqui e obrigado também por, acho que estes eventos são algo que devem repetir e que muito contribui também para todo o crescimento e para toda a evolução, não só também da área tecnológica, mas também esta área que é muito importante, que cada vez mais temos de estar atentos para os idosos e não só, e também nós seremos os futuros. E por isso acho que é de louvar todas estas iniciativas. E a todos muito obrigado. Okay? Thank you.
Okay, thank you. Just to say that it was really very good to be here with you today. We could sponsor this meetings, but we made the effort because we truly believe that digital health, well, we have a lot to learn from the Empresas Care. So the way forward is really to co-create. And so it's very good that there is people from several areas here. And I'm lucky enough to work in a company where we can develop our solution at the same time and supporting the clinical protocols with this co-creation thing, but it's something that of course we want to do with you all. So thank you.
Thank you so much, Anna. And I just ask a quick question. Who knew what was this place before we had here Microsoft and all these beautiful neighborhood Espoo? Who knew what was this part of the town in the past? I knew, right? So for the ones who don't knew this part of the town, of the most filthiest part of the town with very decayed industry, old buildings, shipyard there, it was very, very ugly part of the town. And now I invite you all, when you leave this meeting, to go outside and enjoy this beautiful, beautiful neighborhood that we have built here all together. And it's a privilege of being a neighborhood in the city of Lisbon. And when you do that, think about health, because it's no longer digital health. But this is what's going to happen. If digital transformation assists health, that's the neighborhood we're going to have. And right now, our systems are what this part of the city was in the past. So we need to all together make this transformation. Thank you, Microsoft. Thank you, dear sponsors. Thank you, participants, for being here with us so late. And Anna, Bonnie, thank you so much. And see you next time.
It was a pleasure. Thank you.